Hello, and welcome to this fifth edition of the Cities Changing Diabetes Rounds, or short, CCD Rounds. My name is Niels Lund. I'm the global lead for Cities Changing Diabetes, and I'm also the Vice President of Prevention and Health Promotion at Novo Nordisk. Cities Changing Diabetes works to address urban diabetes, and with a particular focus on the most vulnerable groups in cities. And we've been doing that for the past 7 years, since 2014, and now are active in more than 35 cities. This also means through the years we have collected a number of very good, but also very different examples of what action can take place in cities around the world. And over the past 6 months, as part of these CCD rounds, we have heard about super settings in Copenhagen, faith and diabetes in Houston, foodscapes in Bogota, and healthy goals in Leicester. All of these sessions are available on YouTube. If you search for Cities Changing Diabetes, you can find the channel where this is available. But as I said, this is now our fifth edition of the CCD rounds, and today we will focus on childhood obesity and the challenges related to that in cities. And for that, I'm delighted to introduce our two speakers today. We have Jewell, who's a nutrition specialist at UNICEF's headquarters in New York. And we're also joined by Corinna Hawkes, who is a professor of food policy at the City University of London. Joe will first introduce the UNICEF roadmap to support healthy urban environments for children. And then Corinna will talk about how learning from children's lived experience can help inform urban policy for action. Our speakers will speak, give or take 25 minutes, and then we'll move into a Q&A sessions as we normally do, where you can participate online. And the way you will do that is that when we get to the Q&A session, but also maybe during the presentations, that you click on the question mark to the right of your screen, and then enter the question in the chat. Then the question will be fed to me, and I will pose it to either Corinna or Joe, or both, depending on your question. But let's get right to it, and let me hand over to Jewell for your presentation. Thank you.
Thank you very much, Niels, and it's great to be here today for this CCD Rounds event. As already introduced, I work at UNICEF and I'm a nutrition specialist focusing on the prevention of overweight and obesity. So it's a very linked to the focus Cities Changing Diabetes program has in terms of preventing overweight and obesity and minimizing chronic non-communicable diseases. Today I'm going to be talking to you about UNICEF's work in this space in terms of shaping healthier food environments for children in urban settings. Next slide, please. The overview of my presentation today is going to be focused on why does UNICEF think about cities, and why is the changing face of malnutrition relevant to this conversation? Yeah, thanks. And why do we need an urban food and nutrition agenda for children? What actions can cities take, and how will UNICEF contribute? Really, we come to this agenda with a focus on overweight and obesity prevention, but as UNICEF, we're working on all forms of malnutrition. So we need to think about what are some of the challenges facing low middle income countries in this space, and how can we have a joined up agenda to help them improve the nutrition outcomes for children around the world. Next slide. So it should be, go back a couple of slides. One more. Thank you. So when I'm talking about the change, one slide back, please. When I'm talking about the changing face of malnutrition in the world, it's probably worth spending a little bit of time to understand what we mean by that. So first of all, we should start off by recognizing that there has been historic progress in addressing child malnutrition around the world. So since 2000, we have actually reduced the number of children with stunting by 55 million, and the proportion of children suffering from this condition has declined by 1/3. So this does, say that there is reason for optimism. Change is possible at scale for children around the world. However, there are still immense challenges, and the face of malnutrition is evolving. Today, at least 1 in 3 children is still not growing well because of malnutrition. And overweight and obesity is one of the newer challenges facing children around the world. And that is why we as UNICEF start to work on overweight and obesity prevention, because it's a problem that starts early, with nearly 40 million children around the world under the age of 5 already living with overweight and obesity. But it's something that gets progressively worse across the life course, so that by the time we're looking at school-age children and adolescents, we have almost 340 million children living with overweight or obesity. So it really is becoming a problem of a huge scale. And of course, it goes without saying, and many people in this audience will be aware of the consequences of overweight and obesity for people affected, in terms of not only long-term health consequences, but also the stigma that they can face living with that condition. And we also want to underline as UNICEF that this is a problem for children in every region of the world. This is posing challenges for low and middle income countries, and really we need to shift the narrative around overweight and obesity from one that is focused on high income countries to one that is truly global. Next slide, please. Thank you. And what is driving this changing face of malnutrition? Globalization, urbanization, the focus of our topic today, inequities, and also health pandemics are posing critical challenges for children in terms of giving them optimal nutrition. And one of the factors driving overweight and obesity in low and middle income countries is this globalization of the food system, particularly in urban settings, which has led to an increase in the marketing and consumption of processed and ultra processed foods, which are often high in unhealthy fats, sugar, and salt, and can lead to an excess energy intake and weight gain. This figure shows here that around the world, young children, for example, are fed at least one unhealthy food or drink daily. And so this is just a snapshot of some of the challenges facing families in trying to feed their children with nutritious foods. Next slide. Thank you very much. And so UNICEF's nutrition strategy highlights urbanization as one of the key global trends contributing to this changing face of malnutrition. And it's important to say that global demographic growth has become almost a purely urban issue, with millions of people leaving the countryside for urban areas. So the focus of today around urban food environments is increasingly relevant for the majority of the world's children. And this has implications for the way in which families are feeding their children, because it introduces a new disconnect from food production. It has implications for lifestyles and also the cost of healthy diets in urban settings. And on the one hand, cities are important generators of wealth and employment, and cities are incredibly important, but paradoxically, they have a very high concentration of vulnerable people who maybe have job insecurity, lack poor housing, and they're unable to meet the costs of a healthy diet. And that is why it's increasingly important that UNICEF, which always takes the focus of the most vulnerable, has a reflection on the urban food environment lens. Next slide, please. So the goal of UNICEF's work on nutrition is to protect and promote diets that support optimal nutrition, growth, and development for all children in all contexts. And of course, this requires a context-specific approach, and there are some aspects that apply both across urban and rural contexts, but urban populations definitely face some specific challenges. For example, the cost of nutritious food is a real obstacle for many people living in urban centres. For example, the price of a nutritionally complete diet can cost as much for one person as the entire household budget. And cities are often more disconnected from the supply chain, making them more dependent on an external food system, which we know is subject to more shocks and vulnerability today. For example, health pandemics that we've just been through with COVID-19, but also climate change. So urban dwellers are often very vulnerable when it comes to food security. Cities are also increasingly characterized by obesogenic food environments with low availability, accessibility, and affordability of healthy foods, and contrary, aggressive marketing of unhealthy foods, including snacks, sugar-sweetened beverages, and large portion sizes. And these factors definitely lead to unhealthy food consumption patterns. There's, of course, the physical and built environment perspective, where less space is allocated for walkability, for physical activity as part of daily life. But then there's also the built food environment perspective, where less space is foreseen for growing nutritious food, and there's this increased density of unhealthy food retailers, in particular around schools, which can have an impact particularly on children. Next. One more. So for this reason, UNICEF has started to build out our work on urban food environments. And we actually published last year an urban food roadmap looking at how we would work. And we focus on 3 dimensions. One is, what are the actions that cities can take to improve the accessibility of nutritious foods, to improve diets? What can they do in terms of the services that children and families require to have optimal nutrition? And finally, what are the good caregiver practices? Next slide, please. When we think about what cities can do, we need to think about it through a systems lens. And UNICEF, in all of our work on nutrition, thinks about 5 key systems. The first and most central is, of course, the food system, and I will spend a little bit more time on that one. But obviously, there are other systems that are relevant for nutrition and that can make a contribution at the city level as well, including the health system, the education system, the social protection system, and water and sanitation as well. And all of these systems need to work together in unison to deliver better nutrition for children living in urban settings. Next slide, please. One more, thanks. Back. But when it comes specifically to the food system, you can break the food system down further and think about what actions can cities take to improve the functioning of the food system for nutrition and diets in urban settings. And I won't go into the details here, and you can find this if you look at the roadmap, which may be made available after the seminar today. But cities can take action at the supply chain level, so they can improve the connection between production and consumption of nutritious foods. They can invest in short food supply chains, and they can also provide space and infrastructure for urban environment. As you move to the center of the framework, this is action at the food environment that cities can take, so they can support retailers to provide healthy food that is affordable in all parts of the city. So look at how supermarkets, fresh markets, corner stores, and informal vendors can all make a contribution to ensure that nutritious food is available. They can look at the food environment from a settings perspective, so ensure that healthy food procurement at the city level ensures healthy food environments in schools. They can also look at planning rules that they may have control over that could, for example, ensure that certain areas of the city do not have an overabundance of unhealthy food retails. They can also use their powers to implement taxes on sugar-sweetened beverages, for example, and or bans on marketing of unhealthy foods, such as in public transport, that a city may have control over. Finally, if you move all the way over to the right, you'll see actions at the caregiver level, which is more what a city can do to help caregivers and children themselves. And this may be, for example, through social protection schemes, but also to investigate and act on factors in day-to-day life that influence decisions around food and nutrition. For example, what can be done at the city level to improve the convenience or the attractiveness of nutritious options, or address issues like time poverty that people face every day, and that has an impact on the decisions they make about food. Next slide, please. I just want to highlight some case studies that UNICEF did together with other actors to inform our roadmap. One looking at the Amsterdam healthy weight approach, and another one looking at Quezon City in the Philippines, which are two examples of cities that have taken citywide local government-led action aimed at achieving healthy weight for children or food security. And both from quite different contexts, one high-income country context, one low-income country context. But both were very informative around how a city can take essentially an urban food systems agenda, an integrated approach to food, and working across multiple sectors in collaboration to address what are very complicated challenges. So I do encourage you to read those carefully. And as I mentioned, these all informed the roadmap and are informing the work that UNICEF is doing in this space. Next slide, please. And this is my final slide, which really focuses on what did we arrive at in terms of our roadmap and the pilot work that we're doing in this space in terms of the contribution that UNICEF can make. Firstly, I think bringing a child rights perspective is very important. The contribution that UNICEF can make, focusing on what are the decisions and what are the policies that really act in the best interests of the child. UNICEF is uniquely placed to reflect upon the ways in which cities are or are not working to deliver better nutrition for children, and to identify what are the challenges, barriers, but also opportunities that cities can take in this space. UNICEF is also able as an actor to work with multiple sectors. So we often have entry points with different parts of government, whether that is the health, the food and agriculture, the social protection system. And I think that is something that we can also contribute. A governance approach is also useful, and one of the things that we reflected on during the development of our roadmap was looking at whether what are the actions that a city is best placed to take versus a national government, and to help cities look at the governance structure and take action themselves. And finally, a learning approach. I think UNICEF, the way in which we work with countries and governments is also an opportunity for us to sort of pilot, learn, evaluate, and improve. And some of the actions that we are taking include evidence generation, a focus on children's participation, and running some pilots particularly in Latin America and the Caribbean, and all pulling this all together in terms of knowledge sharing, which will take our work forward in the years to come. One of the pieces of work that we are doing with Corinna Hawkes, who will be the next presenter, is actually bringing together some of this evidence generation and children's participation, and is focused on the concept of children's lived experience. So what is it that children experience in their day-to-day environments and their day-to-day lives, and how can that inform our understanding of their situation, and also the potential policy solutions to overcome the challenges that they face. So next slide is just to say thank you, and to hand over to Corinna Hawkes. Over to you, Corinna.
Thanks very much, Joe. Good to hear about what UNICEF's doing in this area. So as Joe mentioned, I'm going to be talking about how insights from lived experience can help inform urban policy action to improve diets and nutrition. And this has been the focus of work that I do with my team at the Centre for Food Policy for some years now. And I wanted to start by, in the next slide, just briefly talking about what I mean when I talk about lived experience research and how it's distinct from other types of engagement with people. Listening to opinion, asking people for opinion, is an important thing to do, but it's not the same as listening to lived experience. Participation in research is also something that's very important, and there are lots of methods of doing that. And that's a way of enabling and giving people power in the research process. And lived experience research can involve that, but doesn't have to. What I mean by listening to evidence of lived experience in research is through using a range of methodologies. It could be interviews, could be focus groups, could be observation, could be asking people to take photos. And it's designed to understand how, in this case, children experience their everyday lives in the context of their lives. So what we've been doing is work like walking on routes with participants, where we make observations about how they're behaving, what they're saying. We talk to them at the same time on shop along interviews, and at home as well, to understand the interactions between the multiple systems that influence them. So perhaps around their socioeconomic status and how that interacts with their food environments, issues around their emotional health and how that influence how they interact with their food environments. So it's going beyond empirical measurements of food environments and asking how do people actually experience and engage with their food environments. I'll give you an example of this in the next slide, which comes from work that I did as a part of my work as Vice Chair of London's Child Obesity Task Force, which was not a formal research exercise. So this does not have to be done through a very lengthy formal research exercise, but can be done through engaging with the community and talking to members of the community. And we had that access as members of the London's Child Obesity Task Force. And what we did is we spoke to children of different ages and their parents and their schools about their daily lives and how they experience them. And they're published in this document, What Makes It Harder for London's Children to Be Healthier. And that informed the 10-point plan we made for London as part of the task force, Every Child a Healthy Weight. And if you move to the next slide, I'll give you an example about why this is so important. There is a lot of well-meaning work to try and help children be healthier and eat healthier diets. And that's fantastic to see. But if we're really going to tackle inequalities, which is the focus of this work on lived experience, we need to really understand how children could be expected to react and engage with particular policy approaches. So if you click forward, please. This example, which is a composite example, is of somebody we call Justin, who's 2.5 years, who lives in really impoverished circumstances in London. Unfortunately, London is an extremely unequal city. Where his mother is out of work, there's limited money around, there's limited opportunities for play, and lives in a very small, uncomfortable apartment or flat, and is unable to sleep because of all the noise that's around, and wakes up a lot in the night. So wakes up very disgruntled, not really able and willing to eat any kind of a healthy breakfast. And besides, there's very little cooking facilities in that particular apartment. But in London, there is, as in the rest of the UK, there is a certain amount of free nursery hours per week. So if you click through to the next, they a few times a week, they will walk down to the nursery. But because of the rather chaotic situation at home, Justin will be hungry and on the way to nursery, and the easiest thing and the cheapest thing is just a really unhealthy snack. He'll ask for it, he'll pester for it, he'll want it. It'd be very stressful for the mother to deny that. It'll be there, it'll be available. It makes sense that the mother buys it for him. And then when he gets to nursery, moving on to the next one, please. Sorry, if you move on to the next one after that. In nursery, fruits and vegetables are available because London has a really excellent early years scheme in which fruit and healthy snacks are made available in nurseries. But Justin is not accustomed to eating these foods because he's not been exposed to them at home. So just merely making them available in the nursery simply isn't sufficient in order to encourage them to eat them. So he just doesn't engage with it, it just leaves them. So in other words, this is an excellent policy, but he's not engaging with it because of his home circumstances and his difficult circumstances that he lives in. And therefore, the nursery also really needs to help him with some taste education and extra support, and training is needed for early years staff in order to ensure that boys such as Justin have extra support in encouraging them and exposing them to healthier food so that they gain a taste for it. So that's an example about understanding the difficult circumstances in which Justin lives would affect what kind of policy approaches will be effective. In this case, absolutely provide the healthy food, but also extra support for him and the early years staff that are there to support him. If you move on to the next slide, the work and the next, please. The work, this kind of work, and as well as the various projects that we've been doing at the Centre for Food Policy, which is led by my team, for which I'm very grateful for all the work that they do. I wouldn't have been able to do this without them, has led to a series of insights that indicate that if we're going to successfully encourage children to eat healthier, there is a series of conditions that need to be in place to enable that to happen. So children and their caregivers need to have knowledge and information about a healthier diet, which they often do, but not always. People need to have the skills and literacy to access, buy, and to navigate those food environments. This is particularly important for adolescents. Children need to have the emotional health, if you like, to be able to prioritize healthier diets. The family of Justin did not have that and wasn't supported in that way. They need to have access to a healthier diet. They need to have the assets to access and prepare the healthier diets, like kitchens. They need to be able to afford a healthier diet. They need to be prompted to buy healthier diets. They need to find value and meaning in healthier diets and have the social support to eat a healthier diet. So all of those things need to be in place in order to transition children away from eating an unhealthy diet to a healthy diet. And this is what we have learned through the work that we've done on lived experience. And in the next slide, I'll give an example about how we've generated this kind of knowledge and why it's important, again, to reiterate the importance of using this to identify effective policy approaches and why that's particularly important in an urban setting. So this is some work that we did in partnership with UNICEF and the Nutrition Center of the Philippines in 6 places in the Philippines, including some cities as well as some rural areas as well. And we used the team in the Philippines, they used observational approaches, focus groups, and in-depth interviews to identify, again, the daily lives of young people in the Philippines. And they identified that, they observed that young people have frequently eat unhealthy snacks, both locally produced and from the commercial marketplace. It's very, very common, even in the most rural areas, but even more so in the urban areas. And they found that young people have knowledge and information about what's unhealthy and unhealthy. That was not the issue. Skills and literacy wasn't an issue, but they had extremely widespread access to unhealthy snacks. They were everywhere. And they had the assets to access them. They didn't need to do anything but walk from their houses and buy them. That was it. They're also very inexpensive. And while they couldn't necessarily afford the expensive, really branded ones like the multinational ones, even at the lower end of the income range, they were able to afford some of these unhealthy snacks. And they were prompted to buy these unhealthy snacks. There was lots of advertising that made the snacks aspirational. And so even if they couldn't afford the ones that were advertised, they were using phones quite a lot, and they're watching television and seeing billboards and so on. And so even if they couldn't afford those ones, they still kind of created a culture around eating unhealthy snacks is a good thing. And as kids who had to work really hard at school, had a tremendous amount of chores to do for their parents, one of the very few opportunities that they had to exercise agency was to choose an unhealthy snack. And when they got together with their friends and with their family, eating unhealthy snacks was part of their social life, which of course is very important to young people. And this also meant that their psychological capacity, when they were busy doing lots of chores, trying to get a break, that emotionally they wanted to connect with eating unhealthy snacks because it was a break in their day, and it supported their well-being in different ways. So once you start to understand all of these different elements that are influencing why young people eat unhealthy snacks, you realize that food environments are incredibly important because of access and affordability and appeal and advertising. But there's also a whole load of other things going on in their lives around that. They're busy doing chores, they have very other little opportunities to make choices, which means that these unhealthy snacks are extremely appealing. And it's only by understanding that you think, okay, what do I do? Do you just take all those unhealthy snacks away? Probably not, actually, from a policy perspective. Much better rather to think, how can we encourage children to take agency to actually want to eat healthier snacks? How can we provide social spaces for those young people that is going to encourage unhealthier snacks? Well, we also set standards and implement regulations that remove the unhealthy snacks. What this tells me is you need to do both. And in an urban setting, where children are often in intense social contact, and there's a lot of peer-to-peer and a lot of stress and a lot of issues around living their lives, this becomes particularly important. So just to end, I'd just finally like to make the point that we do believe, and if you go on to the next slide, that doing this lived experience is a really important space for researchers to engage with policymakers, because researchers can gather this kind of research and then communicate it to policymakers to help inform policy, which is the kind of work we've been doing with UNICEF. And so the Centre for Food Policy has established a community of practice of lived experience of food environments in order to bring researchers together who work in this space globally, and the policymakers who are interested in these types of approaches. And as part of that, my colleague Kimberly Neve led on the development of a resource where we've pulled together the available methods which are designed to capture lived experience. So if anyone is interested in engaging with that, then please do let me know. Thank you so much.
Thank you, Corinna, and thank you, Joe, for really an exciting both a helicopter perspective, but also bringing us to both to inner city London and to the Philippines. It just shows that, you know, the more you dig, the more complicated it gets, and you think that you know, it might be. I mean, the question is, so what do you do? One thing is, as you're mentioning, Corinna, the more that you study this, you of course open or unpeel the onion to understand what is at the core, and then you can also design strategies. But then also, how do you apply what do you then do in practice? Now we are moving into the Q&A session for a discussion. I'll lead off the discussion, but as I mentioned at the beginning, if you have a question, then click on the right side on the question mark on your screen and type the question there. Then I will get it on the screen just up there, and I'll blend it into the debate. So maybe I should start with you, Corinna. And with a question. One thing is, of course, to understand, and I think that's important to understand what the problem is. But do you have any recommendations for how cities actually who want to improve their food environments and they want to apply the lived experience approach? How, what would be the first 1 or 2 or 3 things that they should do to get that knowledge and then be able to move to something where they actually try to improve on the situation?
So I think the first thing that cities can do is to take a place-based approach to understanding what's going on. So going into particular parts of the city where there are particular problems and trying to identify what is going on in that particular area. And as I said, it doesn't have to be a really long, lengthy research process. It can be a few focus groups or some engaging through photography, for example, some engagement that at least begins to provide some kind of insights about what is going on in those particular communities. And so that's one thing they can do. And the second thing is to establish some kind of minimum areas of action. So it's like universal things that are actually needed everywhere. So despite the importance of local context, there are some things which are needed everywhere. So one of those things is that marketing to children of unhealthy foods has no place anywhere in the world. And so cities need to see what they can do to try and remove that. It's just unhelpful in every shape and form. So that is an example of something that needs to be done everywhere. And then the third thing is to identify some specific things that need to support their young people in those places. And I already indicated one of these already, which I think is really important, which is leveraging the social power of food. And the way that young people find meaning and agency in food, to say, right, we're going to provide some social spaces in our city that are focused on health. We might not explicitly talk about health, but which are around trying to encourage children to take agency and to enjoy eating healthy food together as a group, as opposed to enjoying the unhealthy snacks and the fast food and so on. So it's really about competing with already, and that's tough. But I think that's a really good place to start for cities.
So what role would a municipality or city government take in that? Because there, of course, is many forces at play, and maybe the municipality only has a limited scope of possibilities in regulating on the one hand, and on the other hand to provide those spaces that you're talking about. I know you've been working with this, and you also mentioned it in London. I mean, what are the good examples from London that can inspire others, if any?
Yeah, so I think London is a good example of where they've tried to find spaces where they can actually have power. So the clear example is the Mayor of London made the decision to restrict unhealthy food advertising on the land that the mayor is in charge of, controls, which is the transport. It's called Transport for London, which is our transportation authority in London, and removed unhealthy advertising from that space. And even though that's limited and it's only one part of the advertising, it meant that others have followed to try and expand those restrictions. And in terms of actually then doing something positive to try and create spaces, I do think it's really important to work in partnership, very important to work in partnership with civil society, with the NGO community, with programs, with community programs who are serving these communities and taking that community level approach. A government can't do this on its own. It has to engage with the community.
Yeah. I think you're very right, and actually speaking about the communities, I mean, and let me turn to Joe for a question here, because UNICEF is engaged, globally, and with a particular emphasis on the global south, and in many ways, even in the most challenged societies, there are pockets of resilience and civil society. I mean, at least that's my experience. You will always find pockets of resilience or action by different community groups in here. But from your experience, Joe, what role can communities play in improving nutrition for children?
Yeah, thanks very much for that question, Niels. And I think that was one of the things that we looked at as well when we were preparing the two case studies from Amsterdam and Kazan that UNICEF published. And one of the why it was important as well to look at two quite different contexts, one in the high income and one in a sort of low middle income countries, also just to understand what is feasible in different contexts, in different resource settings. And I think just going back as well to some of the points that Corinna was making as well around, the need to engage multiple sectors and multiple actors came out quite strongly in both of those. So, for example, the need to look at, the agriculture and food production, education, the working environment, actors who have powers to alleviate poverty, those who have controls over the health sector, but also sport and physical activity, housing, transportation. And so, that's from the sector perspective, but then from the community perspective, certainly both contexts were very much definitely looking at engaging community leaders, because I think for the reason that Corinna was mentioning, whilst there are universal actions that should be taken, often you do need a place-based approach, and both Amsterdam and Quezon City looked at these sort of neighborhood-based activities built around community networks. And often that could be, for example, spiritual leaders, self-help organizations, other local community actors who can serve as advocates in the community for some of those actions. But I think one of the things, going back to the point that you were making, Nils, as well, like I think the more we learn about it, the more we understand that it's a complex issue, and that's where we started. We all started out with that understanding, but the more we learn, we understand it's even more complex than we thought before. But perhaps the things that you can do from the lived experience, but also sort of evidence generation around what are the challenges that people living in cities face, is to think about ways to break it down into more manageable pieces, which together, if you take action, will create a comprehensive response. And so I think, the cluster-based approach that Amsterdam took was thinking about what are some of the key things that are going to have across sectors involving different parts of the community, what are some of the actions that are going to have an impact over time in reducing this challenge. And I think Amsterdam is one of the nice things that they mention is about it being a marathon, not a sprint. So it's going to take time. But if we invest in early life prevention, the first 1,000 days activities, if we look at schools, they're obviously very important. If we look at certain neighborhoods, because of the inequality perspective, we have to think about what are some of those neighborhoods that are particularly badly affected. Then what are the healthy food and built environment actions that we can take? And finally, I mean, it goes without saying as well that what is the individual support that children and families need, including sort of management and treatment for those who are affected by obesity in the Amsterdam context. So I think clustering, breaking it down into manageable pieces, and also thinking about clusters of important areas of work are some way of taking the learning and knowledge that we gain and making it more practical.
And I think you're completely right, Joe. And I think it's a different topic, but for example, the example from Iceland about how to reduce consumption of alcohol in adolescence, where it's really a cross-sectoral approach, engaging parents, schools, communities, sports clubs, and across the board with different types of interventions. Some carrot, some stick. It's really, there's not a one thing that will fix it to actually bring this forward. It's really a complex problem here. But you've talked, both of you have talked about the importance of community, of civil society, of having a place-based approach. And there's a question here online from Georgia, and maybe I can ask you, Corinna, and I'll read out the question. Do you think health technologies can help tackle eating behaviors in children, and if so, how? And it's not like there is a as I understand the question, it's not, is there a technological quick fix, but have you found examples where technology has been helpful in driving this, or is it first and last a community place-based effort that is needed, or will be succeeding?
Well, I think there's a place for everything, and it's not one thing or the other. I won't claim to be an expert on technologies. What I will say is that clearly young people are very engaged all over the world with online technologies and apps and these kinds of things that are currently used, really, I would say, to not encourage healthier diets and healthier eating. And it would be exciting to see how digital technologies could be used in a sustainable way. I get a bit concerned about the use of apps, which become like a trend and then it disappears after a few weeks. But Is there a way of actually using digital technology in a sustainable way? I don't know the answer to that, since I'm not an expert, but it is something that I think could be important. And one of the London boroughs is decided actually as a borough, as a local authority, a local government, to develop an app that was specific to the children in that local area. It was about consuming vegetables. And they report very favourable results from that, and that was locally developed and co-created with the children in that borough. And I think that is technology is a good way where you can actually engage children, since they're often very excited.
Yeah. Thanks. You talked, both of you, about the regulation and limitations, particularly on marketing practices and simply outright banning of marketing of unhealthy foods to children. And I think that is an obvious way forward. There's a question here which works on the kind of the positive incentive side, and it would be interesting to hear maybe from you, Joe. And I'll read the question from Maybrit. Has tax reduction in healthy food been tried, and for a considerable period of time, anywhere with success? So providing for example, a reduced value-added tax on fruits and vegetables. Do we see any evidence that this is the positive incentives actually do work in this context?
Yeah, I mean, I think there is evidence that subsidies work, but I think you need to think about the way in which you implement that subsidy. So improving the affordability of nutritious foods such as fruit and vegetables does increase the consumption of it. But I think sometimes the best approach is probably to have targeted approaches that increase the affordability of those foods for specific groups. So, and that's why we also always think as well about social protection to overall increase the purchasing power of vulnerable communities, and then making sure that social protection is nutrition sensitive as well. So ensuring that poorer groups have access to fruit and vegetables. But yes, there is evidence that subsidies are part of the solution. And could be introduced at the same time as, for example, a tax on sugary drinks and sugary beverages. So using both levers to decrease the affordability of unhealthy foods and increase the affordability of those foods we want to increase the consumption of. It's just sometimes you just need to look at what is the best mechanism to ensure that the affordability increases for those groups who need it most, because that is the challenge. But certainly subsidies are part of the package, and we should be looking at that.
Yeah. So maybe I can ask you then to elaborate the list of what we can do. You mentioned taxation on sugary drinks, but in terms of both regulation and taxation, what are the, you can say, best buys or best practices that you've seen in your work to help navigate families and children and adolescents to a more healthier eating behavior?
So yeah, in terms of what we would consider, and this is many people would have heard of it, but for those who are new to it, food environment sort of policies. So what are the policies that can be put in place to improve food environments? And given that we're focusing on cities, let's also focus on some of the actions that cities can take. So it is the case that in certain contexts, depending on the rules and powers that cities have, that they can introduce taxes. We have good examples from particularly the US, of cities that have introduced taxes on sugar-sweetened beverages, and there's good evaluation evidence that they've had a positive impact, including reducing consumption of those products, particularly among children. Equally, cities could have powers to introduce subsidies or social protection packages that increase the affordability and access to fruit and vegetables. They may have planning laws around limiting the sort of density of unhealthy food outlets in and around the vicinity of schools. So you could, for example, set a zoning restriction around schools that says you cannot locate certain retail environments here. You could also look at the density of fast food outlets in certain high streets, for example. In low-income settings, in some cities, you have an incredible density of unhealthy food outlets, and you could look at planning regulations that allow that. And of course, Corinna was mentioning the marketing bans for unhealthy food and beverages on public transportation. Cities should also look at what powers they may have over in order to regulate publicity in billboards in public spaces within the city area. And of course, cities are a huge procurer of food as well, and we shouldn't forget that. Like municipalities often have procurement agreements for whether that is school food, it could be other public institutions, hospitals, and so they can also implement procurement policies to ensure that the foods are healthy and sustainable, which is of course something that we're all working on as well. Environmental sustainability. What are the sort of co-benefits of taking an approach there? So there is a whole package of policies that cities can potentially introduce, and that's where they need the knowledge, evidence, and capacity to do that, particularly in low resource settings, which is the goal.
Yeah. And I think if I may add also that the example of understanding the food landscape or the foodscapes locally, as we talked about in the most recent episode of these rounds, where we had the example of Bogota, where they are working systematically to understand how people live, transfer and stay in different localities, and how that impacts their eating and food purchase behavior is a really interesting approach that Gail has spearheaded, and I think there's a lot to learn from that. In addition to all of the things that the long list that you're mentioning, Joe, it's good to know that there are things that are actually working. The question is whether there is the political courage to actually implement them, and I think sometimes maybe that courage is lacking on decision makers, and that's probably where we from a coalition of researchers, civil society actors, private sector, academia, and others, can help, encourage political leaders to, have the courage, and city administrators for that matter also to encourage them to and give them that courage to take those necessary decisions that actually will change behavior and institute these actions. One thing so we talked about children and adolescents, and I think my personal experience I have two children, and when I think of my son who's 21 now, I think I had an influence in his life maybe up until 12, 13 in terms of setting the right behaviors. And what I would consider as the right behaviors, and then he was a little bit on his own. So adults, parents, their role wanes over time in terms of their influence on how we can help promote healthy behaviors. Coming back to you, Corinna, and I think you had some really, really interesting points about how to address it in the Philippine context. But maybe outside Philippines, or maybe even from London, do you have any examples of effective strategies to engage young people in healthy nutrition? What are the role of peers, role modeling within their own group? Are there any good experiences from that side, in addition to making sure that as you also mentioned, that they also have a space to gather and preferably in a place where they're not overloaded with unhealthy foods?
Yeah, well, I wish I could say yes. There's several examples I could quote, but I don't think that there's yet been enough attention given to actually engaging young people in solving these challenges. And I have someone working with me at the moment who's been looking at how to co-create solutions with young people, and there are other projects that do that. And quite often it's quite superficial. and a lot of work needs to be done to really make sure that they're being deeply engaged and coming up with their own solutions. But one area that I think is really important is to engage, is to enable children to understand what is going on around them. Because, of course, young people, you're just like, well, it is what it is, you just kind of accept it, you kind of get used to it, it just becomes the norm. But once you start actually informing and educating young people about the kind of the food around and the food environments, how they're being mobilized, someone would say manipulated by the food environments around them, then they start to kind of think, oh, really? So I'm involved in an organisation called Bite Back 2030. Which is developing youth boards in which young people are being engaged by actually starting to talk to them about, do you understand how you're being affected by this food environment around you? Do you understand what's in your food? They've got a new campaign called Don't Hide What's Inside, which is about the fact that they are given the impression that food is healthy, and it isn't. It's very high in fat, sugars and salt. And that is building a movement of young people, and it has a national base, but it's starting now to work in specific cities, including London and Birmingham and some other British cities, because that's where so many young people are, and so that is an example about how you're trying to engage youth in campaigning against the problems of unhealthy diets and unhealthy food environments in cities. And I have to say, I've been incredibly impressed by what Bite Back 2030 have done. I'm biased. I'm the chair of the board of trustees, but nevertheless, it does reflect the fact that they're trying to do some background research. They do the background research. They engage young people. They have a youth-centered approach, and that is really engaging young people in a way that currently they're not really so engaged in this issue.
That's interesting and a good example. So I live a very privileged life in a rich country, but I can't help but notice that the climate movement is one that is driven by young people these days, and I can see again within my vicinity of young people that a lot of them are becoming more vegetarian, even vegan, reducing foods and so on, and they can express their climate engagement through their diet in one way or the other. I don't want to overemphasize this point, but is that something you also see where you go, or is it just limited to the a small group of very affluent Danes in in and around Copenhagen, or have you seen that elsewhere? What I've seen.
It is in lots of places. I mean, there's climate activists in many sub-Saharan African countries, for example, young people. So I think that is happening everywhere, and it's something we can't ignore when it comes to efforts to try and promote healthier eating as well as more sustainability, because young people are in general, and the evidence shows this, more engaged in sustainability issues than they are in health issues. And there's lots of reasons and understandable reasons for that. So I do think there's some important questions now about how engaging young people around health will have to also engage with the sustainability and climate change issues and show where the synergies are. Because that's a lot of where young people are all over the world. Thanks.
Maybe that's a message to COP26, which will start next week in Glasgow, I believe, or is it this week? But anyway, unfortunately, our time is up. Thank you, Joe and Corinna, for both take us into your field of expertise and getting us some further insights in both what can be done to address childhood obesity, and also to learn a little bit more about how research methods for understanding learned experience can do for initiatives that we are doing. So to you online, if you missed a point or two, this session has been recorded and will be available on YouTube on the Cities Changing Diabetes channel. And as was mentioned during the presentation, there's several ways to get further support. The research framework is available. You can go to the UNICEF webpage to look at it, to find it there. The search for children eating well in cities. You can find the roadmap there. If you have questions to either Corinna or Joe, send them through to info@citieschangingdiabetes.com, and then we will connect you, and then the discussion can be going. The next CCD round, number 6, will be on the 15th of December, in 6 weeks from now, and will be a completely different topic, but not less exciting, because we'll be focusing on social investments, and social investments for the prevention of diabetes complications, leveraging various funds and long-term investments in actually trying to improve the conditions of people living with diabetes in the city of Aarhus. And for that, we have the Public Health Director of the city of Aarhus joining us. His name is Otto Ort, and he will be presenting the case that is at least in my understanding, one of the first examples of where multiple sources of funding are going into long-term investments for the prevention of diabetes. So let me close by thanking you, Corinna and Joe, for your presentations, and thank you to everyone who joined. Have a good day. Thank you.
Thank you very much.
Thank you.